I actually spoke with several physicians on the trek. Some were associated with the Himalayan Rescue Association.
Okay, yeah, you mentioned
and they take care of trekkers, they take care of locals, they take care of climbers, mountaineers. So they kind of care for everyone along the trek that goes through that town.
Okay.
And when I spoke with them, they said one of the issues with a lot of these expedition companies is that if they have bad weather or something happens, they don't have an acclimatization day. They actually decide to, rather than take a day off on the way down, to just take one day off on the way up, which is really dangerous, and people end up getting sick. Mountain sickness as a result of that. Because they're not taking their time. Okay. It's really important to kind of go slow and acclimatize. A lot of people have never even been to these elevations before,
right? So
you don't know how they're going to respond.
Don't even have most of those elevations in the U.S.
Exactly. So once that was actually a good point, is that when we reached, I think it was 14,500 or 15,000 feet, we were above any mountain in the contiguous United States. So outside of Mount McKinley in Alaska.
Gotcha. Yeah, that's pretty cool. So
it's pretty cool. Yeah, we were like, wow, that's awesome. We did it.
So you mentioned the risk of people getting sick. Mm-hmm. And you mentioned, obviously, altitude sickness is one of the major, most common ones.
Right.
And Diamox is one of the major preventatives. Well, tell me more about what you use to prevent mountain sickness or altitude sickness, and then what are some of the other concerns?
Yeah, so with mountain sickness, the main thing is Diamox is like the preventative thing. Once you start to develop nausea, vomiting, and headaches, it's a little bit late for Diamox, so it's better to start taking it prophylactically a few days before. So that's why we took it before we even went to 9,000 feet. Sure. It was kind of amazing to see the difference, because there was one individual who had a sulfate allergy, and so he didn't take Diamox. And within 2 days, by the time we reached 10,000 feet, he was already having a really bad headache and was nauseous and vomiting. And he had GI illness, so it's always a question of what it's coming from, but he definitely had a headache. And so he actually, in spite of his allergy, decided to try taking Diamox, and he did much better once he started.
Dangerous.
But most of the time, the nice thing is that I had headaches when we reached about 16,000 feet, and I was, obviously you get kind of concerned. You're like, if this continues to get worse, will I be able to continue?
Is this HACE?
Yeah, exactly. So I started taking I would take an ibuprofen, and if I got all nauseous, a Zofran. But for the most part, the headache went away with ibuprofen.
Okay.
And people generally don't take Decadron until they're vomiting or they're having symptoms of ataxia or gait disturbance or some neurological issue.
Okay.
But that fortunately didn't really happen to anyone. There was one girl that ended up being evacuated eventually, because unfortunately that's kind of descent is the only real treatment for it. But for the most part, those things like ibuprofen, Zofran, and just kind of go slow is the main thing. So unfortunately, exertion worsens all types of altitude sickness. So HACE, HAPE, and AMS. So when they've done research into who gets sick and who doesn't, older women actually do the best because they go slow.
Slow and steady wins the race.
Yeah, exactly. And those younger people tend to push it and tend to get sick, unfortunately. But so we found that just some ibuprofen was actually a really nice thing to have.
And tell me about, you mentioned a little bit about HACE and HAPE. Tell me those two.
Sure. So when HACE is high altitude cerebral edema, so it's on the continuum of all acute mountain sickness. It's the worsening of that. And so you end up getting capillary leak and fluid, and you get cerebral edema. And the difference in recognizing the two is really just neurologic symptoms plus a headache and GI symptoms of nausea and vomiting. So when we didn't have anyone that developed HACE on our trip, or high altitude cerebral edema, fortunately. But in the past, there have been a lot of people on our trek who have gotten it, and they've had to put them in a gamma bag to treat that. So a gamma bag is basically like a mini, it's like a duffel bag that's bigger and fits a human being inside. And it's attached to a pedal, which you can, like a foot pump, that you can basically pump up with air to increase the pressure within this bag.
Cool.
And so it simulates descent of 2,000 feet.
Regardless of the altitude.
Yes.
So it's always about 2,000 feet.
Yes. So if you put someone in a gamma bag, it's almost like they've gone down 2,000 feet, which pretty much cures everyone's symptoms.
Sure.
Unless you're like really, really bad.
Sure.
But they're inside, and when, as you know, you can put them in for 15 minutes, and then they'll come back out, and they'll be like, "Oh my gosh, I'm so much better. I can keep going." But like within 10 minutes, they're back up at 17,000, 18,000 feet. So they're feeling sick again.
Sure.
So unfortunately, you have to put them back in, take them back out, and our physicians that were on the trek have seen that happen before with other people, and so they ended up basically giving them Decadron, putting them in the gamma bag intermittently throughout the day, and kind of just observing for worsening of their symptoms, and then when the weather was clear, getting them on a helicopter and getting them out.
Okay, so it is when you're doing Decadron and the gamma bag, you're committed to descent.
Pretty much at that point. If you have any neurologic symptoms, then you are going to need descent.
Sure.
And they say that as little as like 250 feet can make a big difference and make you feel better. But pretty much if someone has HACE, like, you just have to get them off the mountain.
Safety first.
And one of the things that I didn't fully appreciate until I was up there was the kind of limitations of the weather and just of availability of like phone coverage to be able to get help there. So, I mean, if you are at base camp, there's always an ER tent, and there are always availability, for the most part, of helicopters, which is nice. But when you're trekking along in, like, a small town south of base camp, you know, by, 2-3 hour walk, there aren't really as many helicopters that come up.
Which is amazing, because it's such a worldwide attraction. You think there'd be universal service and access, but there's not, I guess, huh?
Yeah, and actually, so I was feeling pretty sick the one day, and I was concerned that I had HAPE.
Gotcha.
So high altitude pulmonary edema, and I took Decadron and nifedipine, which also we can talk about, but that helps treat that. And I fortunately started to feel a lot better after the medications, but we had talked about whether or not, I would be able to walk down on my own, or whether or not I would need a helicopter. And in that conversation, I was shocked to have them, like, my respiratory rate was probably like 35 or 40, and my heart rate felt like it was like 160.
Yeah.
So I knew that my oxygen sats were low.
Yeah.
From base camp when they took my pulse ox, and it was 60.
Low already, sure.
So I was like, I don't have much room to go down at this point, and so I was very concerned, and they told me that it would be like 6 hours before they could get in touch with anyone for a helicopter, and I was like, oh, I better get better. So fortunately, the medication made a world of difference, and within like 2 hours, I was like, okay, I think I can walk. Like I went downstairs. I was able to eat something. I didn't have a headache anymore.
Move and you could eat. Those are good signs.
Yeah, so those were good things. But just kind of, that's not something that you always think about, is just, can a helicopter land here? Can a helicopter get here? Is the weather bad? Is it snowing? Is it too cloudy?
Right. Wind patterns and all that.
Yeah, so it's kind of one of the limitations of treating people up there is just whether or not you can even access help.
So you mentioned HACE. The definitive part of the diagnosis is any kind of mental status.
Yeah, mental status changes, so any neurological findings. Most of the
aside
time...
from headache, though, right?
Yeah, headache is so you'll get a headache when you're at... Pretty much everyone gets a headache at altitude.
Sure.
I'd say when our group reached 16,000 feet, we all sat down, we were all like, I kind of have a headache.
Yeah.
Like, There were only a few people that didn't. And then 17,000, everyone had a headache, for the most part. So headaches are common. Headache plus nausea, vomiting that's acute mountain sickness, so AMS. And then when you have neurologic findings, it's HACE.
Sure.
So
most commonly probably ataxia.
Commonly ataxia. Gotcha. So people not walking, and confusion, generalized confusion, like you're not quite making sense anymore. Sure. And everyone just starts to think a little bit slower, given that level of hypoxia that you're experiencing. So it's like confusion out of the ordinary. So for instance, I remember speaking with Jeremy about something, and I asked him a question, and he literally just stood there, and I was like,
is your brain working?
Yeah, and he was like, oh, wait, what did you say? I don't know what I was thinking. Like, everyone's a little bit slower. Sure. And so actually, when we were doing our lectures every day, they stopped doing lectures when we got to like 16,000 feet, because no one could focus or think. And it was getting colder and a little bit uncomfortable, so everyone decided that we could take a couple of days to reach our summit point, which was eventually Everest Base Camp for most of us. So, and as far as HAPE, that being the other thing. So, high altitude pulmonary edema, or HAPE, is basically when you have hypoxia to these extreme levels, where you have, oxygen availability in the air at these hypobaric oxygen levels that are like 50% of what they are at sea level. So, for instance, when my O2 stat was 60, that's gonna cause pulmonary vasoconstriction, whereas in most of the body it causes dilation. And so that vasoconstriction causes pulmonary hypertension, and eventually you get some capillary leak from the pulmonary vasculature, and that leads to like a pulmonary
normally,
edema.
Right? That's physiologic normally. We have bad lung area, we shut it down so the rest of the lung oxygenates well, but in this case, your entire lungs, both of them, experience this diffusely, and you get pulmonary edema.
And so you'll get pulmonary edema. Unfortunately, like Lasix has not been shown to help. The things that do help are nifedipine, because it's a calcium channel blocker, so it's going to relax some of that smooth
dilation
muscle.
Slightly.
And actually, sildenafil, or Viagra, has been studied, and it's not definitively used by everyone yet, but it is thought to help. And Decadron is supposed to help as well for, I don't know, inflammatory effects. I don't think they know the exact mechanism behind Decadron's steroid for that, but it is a powerful steroid, and I felt an immediate kind of relief after taking those medications. So I think they definitely work. But actually, HAPE is the most lethal of the three, because it's so common. It actually happens quite frequently. And they've done studies where they've actually gone up with little portable ultrasounds and ultrasound people's lungs at altitude, and pretty much everyone has lines everywhere. Yeah, pretty much everyone has some level of pulmonary edema at those altitudes. So I'm sure I had some, and like I said, exertion makes it worse. So unfortunately, if you're really pushing yourself, you're going to be at higher risk. So if you start to feel short of breath, like as they say in Nepal, they say pole pole, which means slow, which means just go slow, just slow down, like exerting
universally,
yourself more.
Right? Slowly up, slowly down. Take your time.
Exactly. Cool. And then when you're descending, fortunately with HAPE again, 250 feet really makes a world of difference for your symptoms. So for me, at 17,000 feet, I was pretty uncomfortable. And fortunately, that was the same day we were going to head down anyway. So after the medications, I was feeling less short of breath, and I kind of just walked down. But I had similar symptoms to like your patient with heart failure that has pulmonary edema. I mean, I felt short of breath lying flat, I had exertional dyspnea, like severe.
Yeah. Oh, it's pretty cool.